I used to be so ambitious and hardworking and did well for myself in life, and then I just didn't anymore. I'm bipolar and I have severe anxiety. And my family says that you're not Colleen anymore. I had an incident in December, January. I went into heart failure. I have trouble with my heart. I have since I was 14 years old. I had a mitral valve mechanically replaced in 2008, and I had rheumatic fever.
If a patient is identified as a HealthLinks patient, which in most areas it's usually a patient who's had frequent emergency department visits or frequent recurrent hospital admissions and has some complexity, that someone who's providing care to that patient will decide that they need a coordinated care plan to improve the overall care for that patient.
Referrals are made either through physicians or care coordinators, or just the mere fact that patients have hospitalizations or repeated emergency visits.
I remember who was at the conference. It was my family doctor, Dr. Maurice Butchie, my sister Alana, my pharmacist was on the conference phone, somebody that represented Canadian Mental Health, Nina.
The idea for them is to come together and wrap around that patient and help them achieve their goals, work through the barriers to those goals as well.
A couple of my main goals were to eat better, like healthier, and to exercise more.
So it has to be something that they feel is important and they want to work on, because if it's something that's directed by somebody else, they're not going to likely want to achieve that goal.
I did make a decision to move into my mother's house. I think the big meeting affected me more because everybody participated, and then I knew it was everybody cared. Like, I was kind of overwhelmed. Not overwhelmed scared, overwhelmed thankful that there are people that care about me. To come together like that and say, we're going to help you, it put me on the right track. It was wonderful. So they set me up with Telehome, which is a wonderful service. I get up in the morning and it's all on an iPad, and it goes through the motions where you take your blood pressure, your oxygen level, your weight, and it all goes through the computer to my nurse. And if something's not right, she calls me right away, and you answer a few questions about your breathing and how you feel, and it keeps me healthy. Like, they keep right on top of things, and I haven't had any problems since. So I feel so much better now. I'm coming back, and this helped me.